Hi, good evening everyone, and we are here at Dr. Dipti Smile Suit, and with us we have Dr. Karan. And so we have Dr. Karan today because he will tell us a lot about how to get your correct smile and your perfect smile. So welcome Dr. Karan.
Thank you, Dr. Dipti, for having me over.
Thank you so much for sparing your time. And if I talk about Dr. Karan, he's an Invisalign expert. He's a diamond Invisalign provider. He's been giving Invisalign for more than 10 years now and has done successfully 1,000 patients, I guess, or a number a little less than.
Yeah, approximately 1,000 patients.
Approximately 1,000. He's an international speaker. Also, he is an aligned faculty. Am I right? Anything needs to be added more?
No, I think that would be enough.
Thank you so much. So the reason of doing this podcast or this chat show with Dr. Karan is because there is a lot of myths attached around how to get your perfect teeth or how to get the alignment done. So sir, I just have one question, starting with not just one question, several questions, starting with in your practice. Sir is practicing in Gurgaon and sir is here in Faridabad with us today. So sir, in your practice, what is the percentage of patients who come with some problem in the alignment?
Dr. Dipti, if I look at the basic prevalence of people who are having malaligned teeth or crooked teeth, there are about 52% of the people who are having this problem, but the issue is the awareness is lacking. In my practice, I would say every patient would have some or the other issue with their dental alignment or bite issues. Sometimes it also goes up to TMG or TMD problems also because of the bite issues, but they are not aware about that. They need the treatment they need that treatment.
So आप कहना चाह रहे हो वो आते किसी और reason से हैं and then you make them aware of that problem?
Absolutely. We as doctors, our ethical duty is that we make them aware about the issues.
But कुछ percentage तो होते होंगे जिनको पता है कि alignment की ज़रूरत है.
Yeah, there are few people who have done their own research or maybe have gone to some other doctor or Google these days help them a lot. They have done
ज़्यादा ही help करता है Google.
कभी-कभी ज़्यादा ही कर देता है, कभी-कभी नहीं, ज़्यादातर ज़्यादा ही कर देते हैं. So they Google research and they have some idea, but as doctors we give them a better idea what is right and what is wrong.
And how do you help them in making them aware of the problem if they're having the alignment issue or occlusion issue?
So Dr. Dipti, if I talk to you about few years back, it was very difficult for us to make them understand what exactly are the issues. But thanks to the technology now, we can use our intraoral scanners very effectively to make them understand on a screen what are the alignment issues, what are the bite issues, and how we can actually show them futuristically also that how the smile can improve, how the alignment can improve, and how the bite can improve if they go in for a treatment.
So you're saying this intraoral scanner is available chairside?
It is available chairside. Anybody can do the scan and show the patient the issues on a screen.
Like even we are doing chairside scanner, and whenever I do it, I use it for my diagnostic purpose. And हम problem कोई और start कर रहे होते हैं chief complaint cater करने की, but then we end up with there's some problem in bite. और जैसे आपने कहा कि बहुत सारे patients ऐसे भी आते हैं जो headache complaint करते हैं या जो opening के mouth पे some clicking करते हैं, so they do require some kind of treatment. So what are the various मतलब क्या ट्रीटमेंट आप उनको एडवाइस करते हैं अगर उनके अलाइनमेंट में प्रॉब्लम है या दांत में थोड़ी से दे आर फॉरवर्डली प्लेस, इनवर्ट प्लेस या क्रूकेड है, व्हाट काइंड ऑफ ट्रीटमेंट?
So there are few options which are available. One is the normal traditional braces that we see. Now there are two types. One is metal braces, one is ceramic braces. The basic difference between the two is that metal ones show more and ceramic ones show less.
Okay.
And there is one kind of braces which are called lingual braces, which are placed from inside. Which don't show, but though they're aesthetically pleasing, but not that comfortable to the patient. Now the fourth option, which is a recent advance which is there, which is clear aligners, which are transparent and they are not visible, very comfortable to the patient, and we can move teeth any way we want to from those clear aligners.
So obviously braces were when we were kids. We used to have our school friends wearing braces, and उस समय उनको खाने में बहुत सारी indications आती थी, sticky food मत खाएं, ये सब ना लें, बर्गर पिज्जा मत लें. तो aligners में do you have such kind of issues?
No, there are no eating restrictions with the aligners. You can remove them, eat whatever you want to eat, drink whatever you want to drink, wear them again.
And पहले braces में ऐसे भी होता था, people they had to hide when they used to smile. So how about the aligners with the
I call aligners Mr. India because our generation knows Mr. India. You feel them, you don't see them. So they are very, very aesthetic. They're not visible that much. I would not say they are totally invisible, but yes, when you put a lot of white light and all, then you see a little bit of shine, that's it. Otherwise, it's not visible.
So, you want to tell more about what are these invisible aligners, how are they processed, their advantages, how are they better than the conventional brackets, and why should people or any age, or is there any age barrier to it?
So actually there's no age barrier to it. A lot of people, there's a myth around that the braces or any kind of alignment should be done in kids or maybe in teenagers. But there's no age bar to it. Anybody can get treatment done anytime. Okay. Age group that we start is somewhere around 8 years.
8 years kids,
yes.
They're also taking aligners?
They're also taking aligners, and 8 years kids, basically we're doing some jaw movements, growth modifications with aligners.
We are able to do that successfully?
Absolutely. It's documented, it's scientifically proven that we can do it. And we used to do it with conventional braces also. It's just that it's just a different appliance that we are using for growth modifications, I would say. The difference, if I say, about the braces and the clear aligners is what you mentioned, that regarding eating habits, there is no eating restrictions with aligners. They're aesthetically pleasing. Now these are some of the advantages what the patient gets, but as a doctor we are able to give the patient faster treatment. We are able to give the more accurate or predictable results with aligners, because the process happens at the scan, what we do it for diagnostics. Through that scan we start with the treatment planning, and then after the treatment planning these aligners are manufactured and shipped to us. And there's a series of aligners depending on the wear of the patient, how many hours the patient is wearing it. Either we keep it a weekly change or a 10-day change, and slowly we achieve the results where we want to achieve.
So minimum duration kitna hota hai for a patient, and maximum can it go up to?
So you're talking to me about the treatment time?
Or the treatment
time depends on patient to patient, depending on how much of movements we are doing. It can go as less as 4 months and go up to about 1.5 years.
Because the reason behind me asking this question is I had one patient, she must have been doing her Reiki with some other aligner companies. So there are various companies who are providing aligners. So for everyone to know that every company has a different way to approach to the patient. So there is no written कि इतनी ही ड्यूरेशन में आपका ट्रीटमेंट अचीव होगा और कोई कम ड्यूरेशन में दे रहा है तो ट्रीटमेंट इफेक्टिव है, ऐसा तो कुछ नहीं है.
नहीं, ऐसा कुछ नहीं.
It is
so it is basically what you mentioned, different companies with different aligners. The material is different, the technology is different. There are few aligners which will say about 15 days change. Some aligners will tell you a weekly change, and in some of my patients I will also go up to 5-day change also.
That's we are seeing here also in our clinic. Yes, many patients are moving fast with their treatment if they are wearing. And how many hours do they have to wear the aligners?
20 hours is something I tell them. That's an average time. Some days it could be more, some days it could be less, but an average time to be maintained around 20 hours.
So देखा जाए तो there's no age barrier, no eating restrictions. You can go for social gatherings, no photography you can miss. You can smile as wide as you can. It's only while eating that you have to remove them.
Absolutely. And a lot of kids that we see these days are into some or the other activity after school. They are going for some sports classes. They can wear them and go to their swimming, maybe playing cricket, football. That's not a problem at all.
And many of the patients who come to us, they are from school, they are in 11th, 12th, or they are passing out from 12th. So, do you prefer that they take aligners and they can go to their, wherever they want to go and study? Because braces mein, I guess you need a monthly appointment, and with aligners?
In aligners, it depends actually. Sometimes we see the patient once in 3 months or even 4 months. Like I said, these kids that I'm talking about who are actually stationed here, all our kids go to some or the other classes somewhere. They are very busy. Their social life is more busy than ours.
Very true.
It's very difficult for them to come and visit practice every month. So this kind of a treatment helps them less visits, fewer visits to the practice, and still we are achieving the results that we want.
And there is something called as Invisalign app also?
Yes. So Invisalign is a brand which is into clear aligners.
Yeah, so it's one of the brands.
Yes, one of the brands where and it's a leading brand. It's based out of US, and these 5-day change, 7-day change happen through Invisalign as well. This app that you mentioned is basically, we call it virtual monitoring.
Okay, so you are virtually monitoring the patient?
Absolutely. So whenever the patient is changing the aligners, the patient is clicking pictures to that app, and it automatically comes to the doctor's part of the app, and he can see the progress through the pictures. And let me tell you, these pictures are also AI based. These pictures are not clicked, they just need to move their head left, right, and it starts clicking on its own. And
so saves the time of coming to the clinic.
Absolutely.
And it's all AI generated time which is coming in. So yeah, I was not per se talking about Invisalign, but yes, there is app to monitor the treatment.
Yes.
So that is how, my concern is that patients should be aware, and there are many international patients who they come to their hometown, they want correction, because outside India these treatments are very expensive.
Yes.
I guess 5 to 6 times more expensive. So do you feel you've had experiences with patients traveling abroad taking their set of aligners?
Many, I think so. We have seen a lot of patients in your practice also.
Yes.
They come, they start their treatment, maybe a complex case also. They take the aligners. We usually suggest them, if you can visit once in 6 months, it's good, but sometimes it's not possible. But still the treatment is going on, and usually they come when the treatment gets over.
So agar full and full dekha jaye to it's a complete package of comfort and ease.
Yes.
With predictable results?
Absolutely, 100% predictable results, and much more predictable, I would say, than braces also, because braces are manually more driven. These are all technology based, CAD, CAM, AI, everything is involved in it.
So sir is an orthodontist. He has the full liberty to do braces, but with everything developing, everything is becoming robotic. जब medicine में robotic surgery हो रही है, then why are we still in a traditional and conventional way of going for brackets when we can have a life more comfortable with the aligners?
Absolutely. It's much more comfortable for the patient because, like I said, fewer visits, comfortable to wear, and they don't have that social stigma that the braces are showing. They can't smile, but with this, they can smile.
There is a difference in the cost?
Yes, there is a cost difference, but I would say it is totally worth it, because if you calculate the cost on patient, your visits to the practice and the discomfort, but cost is something which is, I would say, person to person, it depends. Some people feel it's worth it, some people feel that it's on the expensive side, but that patient has to decide.
Thank you so much. So it's just that I know people do their Reiki before they do visit the dentist, but I personally believe when you visit a dentist, listen to the dentist, have a thorough consultation, and whatever he or she is telling you, you should have that kind of, you should there are patients who have a little bit problem in trusting the dentist because of they say we haven't seen this kind of treatment in childhood, and
it's new technology for sure, but I would say it's not that new also. If I talk about the brand Invisalign, they have treated more than 20 million patients so far. They've been in the existence for 20 years now. They have a big research out of it. And regarding the trust of the patient, a single message I would say to the patient: trust the doctor instead of trusting Google.
Instead of trusting Google, very true. Yeah, Google is doing a lot of their own customer base they are setting up. Thank you so much, Dr. Karan, and hopefully we'll be able to educate more people in taking a right decision towards their great smile. Thank you so much.
Thank you so much. Thank you for having me over.
Thank you.